I think we need to be crystal clear of what is new. Because these services, some of them have been ongoing, but we have what is new. Assistive devices, that is new. Assistive devices include what and what, DG? Hearing aids, if a child has a hearing problem. And you remember when we did the medical camp in my county, we had a child who was 16 years but was in class 5 because they had a problem of hearing. So now we have assistive devices. That child and any other with a hearing problem, now they are covered under Social Health Authority. Are spectacles assistive devices? So they are covered here. Walking canes, are they assistive devices? They are covered here. That is completely new. The other thing that is new is where dental services were available for those with enhanced cover of NHIF. The best cover did not have dental services. Now we have dental services. Accident and emergency services, that is new. End of life, that is new. It was not covered. And you know, this is always an area where people are always also calling for fundraising. You fundraise, seeking treatment. Once the patient dies, you also fundraise for mortuary fee and all that. So now that is covered. Specialized pharmacy benefits. This is new. That if you have a chronic illness prescription, a patient of diabetes, you know, they take their medication throughout. So instead of wasting time to go back to the specialist and you have prescription, you can go to a community pharmacy that is listed and you get it filled. That is new. Mental wellness services. Generally, wellness was not covered. We waited for people to be sick. But now, you have an opportunity to get checked for your annual checkup so that we know early whether you have diabetes, hypertension or not. There. That is covered. Specialized essential diagnostics. Previously, we were covering the very critical illness diagnostics, but not essential. That is now new. Screening for common diseases. Previously, we never used to cover screening, but now screening is covered. So, I'm hoping that you see the reason why we are moving from NHIF to SHA. That now you can report, it is not a change of name. The benefits have been expanded. Based on these benefits, we have a team that has been working for the last 1.5 years doing costing. So that when we talk about mental wellness services, what does it cost for that service to be provided? Based on that costing, we now have tariffs. And we did advertise in the papers. We are doing public participation. Those tariffs, I have had and read questions, including today, Mercy Kahenda, asking, I think you consulted somebody, an economist, and he was thinking that we picked figures from the blues. No, we did not. For a whole 1.5 years, we have been doing costing. So we know. Those figures are based on cost of items, cost of the service. They have not been picked from just the blues. We know. What does that tell you? That health services in this country are highly overpriced. So based on our costing, we are saying we'll deliver services at that rate. Whether you go to a public facility, whether you go to a private facility, whether you go to a faith-based facility, that is what Social Health Authority will reimburse for the service. The other day, when we were engaging our legislators, one of them, who is a top gynecologist, said that 32,000 is not enough for cesarean. Yet, under NHIF, cesarean has been how much? 17,000, isn't it? Under NHIF, that is what we were reimbursing for cesarean. So now we are reimbursing 32,000. And there's nothing unique in a cesarean section done at a private facility and that done at a public facility. The gyna is the same one. Huh? The equipment is the same one. The medication, whether you need anesthesia, is the same one. Whether after that there'll be, is it called what? Suturing or stitching, whatever it is the same thing. Tulitoka kwa episiotomy, Washira is talking about. Episiotomy is for normal delivery, not for cesarean. So the inputs are the same. The only thing that makes a difference is that when I went to deliver my last born baby in Aga Khan, I was given my private room. And I remember there was even music for me. You know? Those are the things that make healthcare expensive. And there was a nurse rubbing my back throughout the labor and asking, what is my favorite music? Those questions are not asked when you go to deliver in a public facility. So this is what we have used to cost for healthcare, because we know with or without that soothing music, you can deliver your baby. So we have costed what is essential. I thought it is just good that I clarify that. So we are finishing on public participation for tariffs. Once we finish, we shall gazette them, and then they become applicable. The other thing that I needed to emphasize is on the registration process. I don't know if you can. And you know, I'm wondering, that image, those people don't look like Kenyans. Please, look for Kenyans and use them, because we want to see people that we know, or at least we can relate. That man with a headscarf, I don't think that's a Kenyan man. So now, this, it is available for the people with a smartphone. It is available for people with the other phone. It's called what? Kabambe. Malika Mwizi. It is available. So I was asking my team, why are we saying star XX, yet we know the code, yet we know the number? And I've just been told that from Friday, we were in Marsabit doing testing. There was a small challenge, and so they are now working on it. But immediately they finish, it will be up and available, but it is star 147 hash. I know you will try now. You may not complete the process because of the reconfiguration based on our testing of the system on Friday. But we expect that by end of day tomorrow, it should now be up and running for many Kenyans to try. Now, I also want to emphasize that we have terms and conditions. So people need to read. They have been simplified, so that then you know what you are opting onto. And only when you accept, that is when you move to the rest of the process. We have worked with the team from Data Protection Office, and we believe that we are doing the right thing. Yeah, I think this is what I wanted to emphasize, and that lastly, to finalize the process is the taking of biometrics. But for now, we have put it at the facility level, that your biometrics will be taken at the facility level. But we are also training our community health promoters, because we have given them gadgets, that they should be able to also take biometrics at household level. Our transition. In January, I gazetted a transition committee, and it has been working day and night. I'm told even this morning you had a meeting. We want to ensure that this transition is as seamless as possible, but also to assure service providers that we are transitioning the assets and liabilities of NHIF. If we owe a facility money, so long as it is verified, it is reconciled, it will be transitioned for payment. So as you write, please tell service providers, we know we owe them, we haven't been up to date, but that is being transited and it will be taken care of by SHA. The transition team is available. The chair is here. Kapkiro, stand so that people get to see you. If you have any question on transition, this is the chair of transition committee. Any other member of transition who is here? Dr. Otachi is here as well. Mwai is there. If you have any questions, please put them out to these people. They should be able to respond to you. SHA, we have a team already. The chair is here, he spoke. Please, if you have a question on SHA, reach out to Dr. Olweny. CEO is here. Who else from SHA is here? Simameni, our reporters. Face them, then they can see your faces. So that if you have any question, please reach out to these people. They should be able to respond. And if you have technical questions, it's the DG. I know normally at times some reporters reach out to me. I can only answer up to a certain level. Beyond that, I say, please reach the DG. And the next thing I see in the newspaper, they didn't reach out. They just wrote what I said, and the details are missed out. Mercy, tafadhali, after DG, when you need figures, you need paragraphs, you need graphs, you need what, look for the DG. He has all the details. But PS and myself, we are available, including PS for public health, Mary Moloni. We are available to respond to your issues. I would like to stop there. Asanteni sana.